the first message would be to Dr. Hood. So, Dr. Hood, what's the difference between a pandemic and an endemic?
Yeah, thank you for that question. First of all, thanks for having me. Um, First, let's talk about an epidemic and a pandemic. An epidemic is when a sudden rise in an infection takes place in a localized area. So, like when the coronavirus first occurred in Wuhan, China, it was localized to Wuhan. Wuhan, that was called the epidemic. When it started spreading across different populations in different countries and then spread worldwide, that's called a pandemic.
Okay.
So the epidemic led to a pandemic, and the virus has now been with us a while. And endemic means it's becoming localized, and uh, endemic means kind of like the flu, where periodically it will happen in certain areas. You may have a flu outbreak here, but not in China. So endemic means it's something that the virus has gotten a foothold within the population and is probably going to be with us for an indefinite period of time. So now it's endemic. And so, yes, I think that means as your title, is this something we're going to have to live with? And I think the answer is yes.
So, are we in an epidemic at this point?
So I think we passed the epidemic. We are in a pandemic, and I think we're slowly but surely transitioning into an endemic.
So, we're in a pandemic at this point. Pan meaning worldwide.
Yes, but I think it's tapering off. And I think if we put on a crystal ball and say, now we've had 2 years to learn something about this virus,
Hmm.
but it looks like from the data that the researchers are looking like that we're transitioning into an endemic.
Yeah, I was going to ask you about the data, right? Because you and I, we look at, we I know where you what where your roots are and the work that you've done for many years. It's right around Rise's office, Southeast San Diego. Obviously, you also have a much broader perspective. But the data, you have data from a worldwide perspective, and then you have data in these communities, right? So, I mean, I care for and I have empathy for someone who lives in South Africa or in Asia or Middle East. But I also I think those numbers might be very different from what I deal with on marketing Euclid. So, what does the data look like for us in these communities that we live in?
Yeah. So let me say this. I do think, although we don't live in South Africa or in China or in Asia, the data there is, I think, important because sometimes it gives us insights
Hmm.
as to what we can expect here. So you're right. Um, uh, Here in the United States, it's even more complicated because we have different states, different populations, and different rules and regulations. And I think that's one of the reasons, although we're far advanced country, the virus has been a little bit more difficult to contain here because of all the various states and rules and concerns and individualism. So, however, here in California and right here in San Diego, when we look at the data, um, I think overall the county of San Diego is doing well as far as the population is concerned. So, uh, looking at the coronavirus case rate, we've had several strains: the alpha, beta. We went to delta, and now the Omicron uh, variant is the most prevalent. And what we've seen is that the beginning of the year it really spiked, and mid January it's begun to decrease sharply.
Hmm.
And we could have predicted that looking at what happened in South Africa and elsewhere.
Hmm. Hmm.
And and I think that's happening for several reasons. Think of the virus just like we want to survive. The virus wants to survive. So I'm going to give you my um, simplistic view and not use doctor's terms. The virus is trying to live like we're trying to live. I think it mutates from a virus that was much more deadly, got down into the lungs, such as the Delta virus, to a virus that tends to affect the upper airways and is not quite as deadly, but is much more infectious. Therefore, it finds more hosts.
Mm,
Um,
mhm,
what's happened in San Diego, according to the data, 92% of the eligible population in San Diego has received at least one dose.
mm,
81% are what we call fully vaccinated, and about 50 plus percent are fully vaccinated plus boosted.
mm,
There's a percent that haven't been vaccinated, but many of them have had the virus, so they develop some natural immunity.
mhm.
Early before, we always talked about herd immunity. Okay,
I
I
haven't heard
think
that. I haven't heard herd immunity for a while.
yeah, I know because as soon as another variant comes, it starts over again. But
Yeah.
I'm going to use that term loosely, and I think one of the reasons why we're seeing the precipitous drop in the Omicron here is that we have a pretty good vaccination immunity and natural immunity of our population. And so it's beginning to go down. And
Mm.
I think that's one of the reasons why they're beginning to loosen up on some of the restrictions and the mask and all that. Okay.
Well, I
So,
think, yeah, I'm sorry.
no,
Or-
go ahead.
I was just to say, I would hope that knowing what Kelsey and Dr. Green deal with on a daily basis, that sounds like it's a good thing, right? I mean, Kelsey, are you seeing any uptick in your recruitment efforts and engaging with individuals who might want to get back into the workforce?
Absolutely. I mean, the market has definitely trended upwards. We have been working with several candidates that are looking to get back into the workforce right away, but it also is dependent on the policies of the firms that we work with. A lot of the candidates who want to know what the COVID policies will look like. They want to make sure that they're comfortable returning to in office if that is the option, or if there's an option for more of a hybrid schedule. And so those are some of the discussions that we've had constantly with our clients and candidates.
Yeah, so folks have a different expectation in regards to the workplace based on obviously these last 2 years
Mhm.
dealing with the virus. And even though the numbers say that it looks like it's going to be a different situation for us here in America and maybe the world, I don't know if those potential employees are going to change their perspective and their expectations. I mean, do you have any insight on that?
Yeah, so with our employers or the candidates that we speak with, I think it has fluctuated a lot
Hmm.
in regards to returning to work. So we've had individuals that were very set on either returning to a hybrid position or to a fully remote role because
Hmm.
we've been in the pandemic for over 2 years now, and some of these people have been working remotely. So they want to be able to continue that if they find success in that. But it's also a little bit of a battle with firms because I see mostly, probably right now we're at an 80-20, where 80% of our firms are currently in a hybrid schedule, but they have hopes to get back to full time in office. So these changes are only temporary until we can have a better understanding of what it will look like in the near future for just kind of around COVID.
Yeah, and you know, it's interesting but they're going to have certain expectations. They've grown. Some of them have come into the workplace during the time of COVID, right? And so
Yes.
I don't even know if they'll be willing to change. And I was thinking about you, Dr. Green. I mean, you just so for everybody to know that Dr. Green is a person who, and her organization does a lot of research and advocacy around working families, the impact of policy on these families, and is very much aware about what these families are going through. And so obviously you got families, you got parents, you got kids, you got grandparents, And I assume that you're dealing with all of that. And what are your experiences so far, and where do you think they're going to go?
Well, thank you so much for that. I mean, I'll start with the work at the Center on Policy Initiatives has always been focused on the fact that we have to think about people as working people, and that often that's the identity that's most ignored and oppressed, just sort of set to the side. But this pandemic has helped highlight the fact that workers are the fundamental aspect of this economy, and that all the other structures have to be able to be set up to support people's ability to work and to work safely. So some of what we're seeing, it's very similar to what Kelsey's saying. People have expectations. They are evaluating their employers and their employment situations based on how well those employers help protect their health and safety. And employers who are not able to deal with distancing, ensuring that there's masking, making sure that folks that they come in contact with are vaccinated. You can see most people in this region want vaccination. They want other people to be protected. And it's challenging when they have to go into workplaces that don't offer that. So I do want to lift up that we still have workplaces that are where we're having our biggest sort of political contests.
Yes.
And they're places where people don't have the option not to be in person. This is in terms of retail workers, folks in the education sector. And we see real challenges there as those employers are being pushed to relax the requirements on the grounds that there are people who want to access these that don't want to follow these guidelines and rules. But the flip side of those businesses cannot run without the workers, whether those are teachers, whether those are the folks who work in the cafeteria, those are the folks working at the retail stations checking you out. And what I hear and what Kelsey's saying is many people are looking at that workforce and saying, I'm not going to go into those jobs. And so that's a real struggle that we have in this economy, and one we're not talking about, that you cannot have a robust economy if you don't have one where workers feel safe and able to protect their families. The next piece of it that we're seeing is that we've seen how this has been a challenge. People have come to understand how important education is, not just for its direct provision of technical skills to young people, but really that it's filling a gap of childcare need. And we're seeing that this pandemic helps highlight that we don't have something that fully wraps around families and ensures that they can meet those childcare needs that, once again, they need in order to be able to be part of the workforce and they need in order to be safe. And so there's real work that still has to be done there, and we're still seeing challenges around that. And one of those challenges is, childcare providers in particular are some of the lowest wage workers in our economy, and yet they consistently tried to find ways to work throughout this pandemic, even as they saw, relatively high numbers of infection. And we saw that across the economy. People who were doing the work that we most needed were both being most exposed to disease, not just this one. This pandemic has highlighted it, but that's always been true. And they were also the folks least likely to be able to access some of the supportive services they needed, childcare for themselves, health, like sick days. This has been a big fight here, the ability to take time off. I just want to highlight that many people were pushing back against restrictions, not because they don't believe the science, but because they did not know how they were going to be able to take time away from work and still be able to support their families. So we have to be able to address that as a public health concern. And we hear that from families.
Yeah, that's Dr. Hood. I see you nodding your head. You probably have some thoughts of that. I have some questions, but I want you to.
Well,
I think you have something to say.
Yeah, well, first of all, let me make this clear. I think everything she said is 100% true. The best way anybody can protect themselves and their family is vaccination. We talked about data. Let me give you some data here in San Diego that for those who were fully vaccinated plus boosted, the hospitalization rate was 0.7%. If you were not vaccinated, it jumped to 2.8%, or a 40% increase, just not being vaccinated. As far as deaths, the death rate for those who were vaccinated and boosted was 0.04%, very low. If you were unvaccinated, it jumped to 0.6%, which is 15 times greater. What this is telling us, and we can have, I don't care what your politics are, you can talk about masks, you can talk about social distancing, your best protection is vaccination. Now, what this is showing you is that there is nothing 100% going to protect you. Okay? I spent 2 years protecting myself from this virus. About a month ago, 6 weeks ago, I got it. But I was vaccinated and boosted, and therefore I had what I called a bad cold, cough, sore throat. I started feeling better. I feel very strongly, and the data supports that had I not been vaccinated and boosted, okay, I would have been much sicker. And as a 76-year-old Black man with some underlying issues, may have been one of those folks in the hospital in death. So, getting to your question about endemic, if you're vaccinated, what the vaccine does, it will strengthen you and protect you from, you'll survive just like you will a cold and whatnot.
First of all, I don't want us to gloss over the fact that this man just said he was 76 years old because he looks good for 76, or he looks good for any age. But you have, and that's a very good point. I mean, I got COVID also, and I was vaccinated, and but I would just say that when we talk about an epidemic, it's not as if, it's if it's not happening to you in your community, then that's one thing, but it could happen, and it could be an epidemic, a localized epidemic, I guess you could call it, something that happens here. And then the impact is going to be substantial. It could be substantial, right? So we're talking about schools being shut down. Kelsey, I'm not sure if some of the folks that you look for and you recruit are going to be in the courtrooms shut down. So that could be an impact on our local economy. And so it's just, it's an interesting, process that we would have to go through to respond to some outbreak here in San Diego. Do we shut down the schools? Do we close down the courtrooms? Do we go through this again and again every year? Or do we just say, you know what, we're just gonna deal with the fallout and we're gonna continue to operate? I don't know if there's anybody have any thoughts on that.
Well, let me give you my opinion. I think we're going to have to, and this is just what we know right now with this particular variant. Okay, anything can happen with a new variant. You mentioned before it will change. So if another different variant or different virus totally altogether comes about with then we're starting all over again. But let's assume there are no more variants. That doesn't mean it's true, but I'm just making an assumption. I think we're now transitioning into a place where we need to start thinking about how do we get on with our lives, okay, and get back to work, get back doing the things that we used to do. The first thing is I think we need to get vaccinated. The other issue is that what's happened during the past couple of years, one of the greatest statistics that's really frightened me was in the first year of this pandemic, we saw the life expectancy in this country decrease for the first time in 20 or 30 years, about 0.8%. However, with Black folks, life expectancy decreased 2.8 years just for Black folks as a result of this pandemic. The other thing we are now seeing because of this pandemic is that access to healthcare has been cut short for a whole lot of reasons. We've seen cancer rates going back up, uncontrolled hypertension, uncontrolled diabetes, and I think and now people are dying from diabetes, hypertension, and heart attacks because we're not focused on that. So I think that's what I mean by we're going to have to live with this virus like we do with the cold and the flu, but we can't forget and neglect the other things that are probably going to be killing us at a greater rate if we don't start focusing on this.
Yes.
If I could speak to that. Yeah. I mean, Dr. Hood may have something to say this. I think the other challenge, though, that we have is that we both have to figure out what life looks like now that this disease is part of our lives. But there's some things that we don't know about the long-term implications of it. And I want to be really careful with that because we don't want to cause panic in people, but we do want to be clear about the questions that we have. So when Dr. Hood talks about the rise of diabetes, and diabetes is potentially, a deadly disorder for some folks, there's some evidence that COVID infection, right, has precipitated some people's like coming into a disease state of diabetes. So like understanding also, there's like a set of folks who are having conversations, like as we try to understand the long-term implications, we might want to have some level of caution about just saying, folks, some number of folks are going to get this, and we just have to live with that. We just have to accept it. I think there's a balancing act that has to be done that continues, as I think Dr. Hood is saying, trying our best to avoid infection, at the very same time. I also just wanted to say something else that was related to what Dr. Hood said. Even when, I think one of the things that's been tough in the work that we do at the Center on Policy Initiatives is that we're always trying to point out that just because something is rare, like in this case, deaths, which are in fact rare, it still matters the disparities. And that was a point I think he was making very brilliantly, that those disparities, so when some set of folks say we just need to get on with our lives, we just need to get back to normal, it is worth examining whether the people most likely to say that are the same people who are being least likely to be affected in a disparity. And I think just visually when we see this, it seems that's the case, that we do see greater, still, the disparity is when this does happen, it's more likely to happen to Black folks, to Latinos in our region. And yet we have another set of folks who are clamoring to say, let's just get back to normal. I think that partially reflects the realities that people are facing and that the loss of life that we've experienced. The other thing that's been a little bit shocking and is that even though these are low numbers, when we've had other things, like I think of it from my generation of something like 9/11, where far fewer people died than we've had died in our, during this pandemic. But it made a huge impact on our lives to have that loss of life. And yet in this case, especially if our families have not been touched by loss of life, it's as if we're glossing over these tremendous number of people who are missing from their families, they're missing from the workplace, they're missing from the communities, and many of them were some of the glue. I mean, the willingness to say that people with pre-existing conditions, people who are older, that we're just okay, that we lost a lot of those folks. I think there's a sort of community grieving that still needs to take place and that we have not made space for. And it is part of what's causing some of the mental health concerns that we're seeing across communities. We are just really not talking about that impact.
So let me just say with Dr. Green, I agree with everything she said. And if my comments were coming across as we just need to get back to normal, we're never going to get back to what normal was prior to the pandemic. We need to get back to normal with caution. Okay? Yeah. And we shouldn't gloss over that. I spent my whole career looking at disparities. It was anticipated even before we knew how bad this pandemic was going to be, that Black folks, I wrote an article in the beginning that Black folks were going to be hit hardest by this pandemic. Okay. So I totally agree with you, Dr. Green, that it should not be glossed over, that we should focus on the issues that you're talking about. But sometimes as an elder, and I'm going to put myself as an elder, I get so frustrated that we become our worst enemies. Okay. I love folks, but every time I look at the number, the best protection is vaccination, and we're the least ones to get vaccinated. The best protection is fully boosted. We have the lowest booster rates. And I know I'm a paranoid Black man. I don't believe everything I read. Okay. However, when I hear some of the things about this vaccine and I go back, they talk about Tuskegee and syphilis. That was a time when there was a drug called penicillin that could have cured syphilis, and they withheld it from Black folks for 30 years. The government did that. Today, they now have a vaccine that could save lives, and we're withholding it from ourselves. So I get the paranoia. I get the concern. I know the history. But at some point in time, we got to move from surviving to thriving. Okay, our paranoia should not kill us.
And I agree with what both of you have said. You know, there are some changes that we have to do from obviously individual perspective, from a cultural perspective, to be able to better address these issues. And then there's institutions and businesses and corporations and other things, independent private things that, or institutions that have to address this too. So it's really interesting that, you know, we're going to have to make some changes. Probably some of these institutions need to be changed anyway. So Kelsey, I know that you all are probably having to make some adjustments, right? I mean, I know you do the recruiting part, and you probably have some other insights on what adjustments that might be being made in some of the industries that you deal with. But what types of adjustments, short term or maybe long term, do you think might be done?
Yeah, so, you know, working with like the client side, we've had several conversations as to kind of navigating what the new normal is going to look like for them, what changes they need to make so they can not only attract talent, but retain their talent. Because a lot of individuals are looking to leave their current positions based on how the employers had dealt with the pandemic. And so it has taken a lot. And as Dr. Green mentioned, you know, mental health is huge. So as my organization, you know, we had taken a step towards like really focusing on that. We have been apart for 2 years, if not more. For me personally, I've actually have not seen my colleagues in more than 2 years. I had left on maternity leave right before the pandemic started. And so I brought our babies home right at the beginning, at the height of it all. And so it's checking in with, you know, your coworkers and your colleagues. And so we've been reminding our clients that, you know, as we are looking to retain new talent or retain your current talent and attain new talent, it's more than just what you're offering on salary. They want to know what your take is in regards to COVID, how we're handling mental health, and how we're going to move forward. So that way we make sure that our employees are set up for success. And these have been a lot of topics also with our candidates who want to make sure that they make the right move for themselves.
Yeah, but what about technology, any changes that you've seen in some of the companies that you work with?
Yeah. Technology has been a big boost, really. I mean, now you need to be very proficient with Zoom, Teams, things like that. And so a lot of clients of ours are either implementing like new training policies or new trainings on those programs and other programs that they want to make sure that their workers that are working remote have the necessary tools. I am constantly speaking with our candidates, testing them on their true proficiency, where they lack and what they may need additional training on, so that they feel confident in going into these interviews with potential employers who are, you know, have a lot more technology-based programs. Because for legal, in which that's the industry that I primarily focus on, legal was an industry that has never been remote before. Having to do depositions via Zoom, you know, or just trials and things like that were all put on hold. And so now as we navigate through new normals, there has been times where we had to do all this online because we can't stop the court system completely. We need to be able to move forward. So there has been a lot of new technology and new people being implemented into these organizations that have a true focus on it. Just because for legal, I mean, we had gone from, you know, in-person courtrooms and things like that overnight to being fully remote for 2 years. And so how are we going to move forward from there?
Less efficiency or better efficiency from a broader perspective, from your perspective?
I think it's better now. Looking back, you know, we've had the opportunity to really hone down on our skills and to see what were the pain points with our clients, where they really needed assistance with. So right now we are in a better place than we were at the height of the pandemic.
But before the pandemic,
we were definitely very less efficient.
Oh, okay.
So less efficient in the very beginning of the pandemic. I think a lot of clients that I've spoken with, their tech departments were just extremely busy trying to get everyone online fully. So I mean, it was something that we've never been through before. So definitely less efficient in the very beginning, but definitely we've made big strides now, looking back from then.
So yeah, Dr. Green, to me, it brings the question of, do we need to do something even more drastic than just technology, which technology obviously has saved us in many ways, right? If we didn't have it, it would have been, I think, it would have been worse. But we're talking, do we need to work 40 hours a week? Should it be a everyday thing? Do we always have to be in the workplace? Is it better for workers for them not to be there? And I know they're not all white collar jobs. I understand that. And you made that point very clear. And many of the people that you advocate aren't in white collar jobs where you can just work in an office space. But anything drastic on the horizon that people are proposing?
I think if anything, what this pandemic did is it attacked one of the forms of misinformation that we've had about the economy for a long time. And it's been misinformation that's been to the disadvantage of workers. For a long time, workers have been threatened if they fought for better wages or better working conditions, with the idea that if they pushed too hard, they would be replaced by technology. And I think what this pandemic taught us is that technology cannot replace so much of what people want from humans, and that technology often requires humans to use it in ways that make it beneficial. So that we're not in any danger of replacing people in childcare or in courtrooms, or technology can assist, it can expand, it can make life different and adapt, but we still need people. And I think that this has been a moment where that's become very clear. And that people should be less afraid of that threat of technology moving forward. Because if there was ever a moment that if companies could just magically, invest all their money in technology over people, this would have been it. They have a shortage of folks willing to come into these workplaces. If technology could do it, they would be doing it. And yet the need for human beings is still there. And that point about misinformation, I just want to take that back to a point Dr. Hood was making a little earlier, because I think we also have been not as clear about the ways in which technology allows misinformation to be targeted to particular people. I think about the fact that if I pick up my daughter who is, 10 years old, we let her use the internet with adult supervision. The internet that she engages with looks different than the one that I do. She gets different advertisements, she gets different news stories that come up and are proposed to her next if I let her watch a news program. And that makes me think about the fact that when I was a kid, there was like a TV in the living room. We all had the same channels. We all got the same information, whether it was about what cars to buy or what disease, like something like this. But now we have a real set of folks who are purposely providing misinformation to members of the public. And I wonder to what extent that use of technology, that drastic targeting of particular messages to people for whatever reasons, is part of what speaks to why, for instance, Black Americans have gotten lots of misinformation about this disease, about vaccine. We know that, and to take it to a slightly political space, we know that's happened in electoral spaces, that different people get different information to trigger different political behavior. And I don't think it's out of the question to say we've seen evidence of that related to this pandemic as well.
Yeah, yeah, Dr. Hood.
Yeah, Dr. Green, you bring up a very, very good point. All my friends will tell you I'm not on social media. They keep encouraging me to do so. And again, I'm just from old school. Too many youngsters don't know how to spell. Too many youngsters have a low self-esteem because it's all based upon how many likes, but I'm not going to go there. Here's what I am concerned with, though. One of the other things is we talked about mental health. The rise in suicide in the youth has actually gone up. I was just reading an article since COVID, suicide rate in African American community, especially in the youth, have begun to rise. I've been looking at health inequities and disparities for 20 or 30 years, okay? And African Americans usually lead in everything, but one thing they didn't lead in 20 years ago was suicide rate. That is changing. And we're now seeing it rise in African American youth. Now, I'm not saying that I totally understand why, but I think with this pandemic, it's disassociated you from friends, and we need each other. We need to communicate with each other. Plus, the misinformation on the social media, which I don't know how much that is contributing, but I also feel that youth do not have the coping mechanisms that other generations have. So now with the pandemic and the social media, something's happening in our community that I think we need to address. I was wondering what your thoughts were on that.
Yes, I mean, I think these are incredibly important concerns to think about why is this happening. I do think it's like so many troubles we have, it's multiple factors that play into this. And I think that the fact that we have not thought deeply during this time about things like grief, which can come from both loss, like death in families, long-term disabling conditions that have affected families, and then the lack of value that we had previously placed on just the fact that schools, and other spaces are places where people are getting their social and emotional needs met. And so I think that's incredibly important for us to do that. But it also means where if we were to prioritize those things, and Mr. You asked this question at the beginning, like if we have to go back to shutting things down, what does that look like? And I certainly hope we don't have to. But if we do, I think that we should prioritize keeping open those institutions that most meet our basic needs. And those may include things like schools, even if that means then having to put restrictions on things that are less healthy for us, like say bars and restaurants, which have found other ways to be adaptive. When in fact, the last time we went through this, we sort of did the inverse of that, right? We sort of focused on so much of the pressure was to reopen things that were not critical and making it difficult for us to be able to move to a space where we could identify those things that were life sustaining, we're supporting. And I think that this happens at both parts of our lives. In particular, I think for very young people, it's incredibly important to be part of a social fabric and connected. And I think it also happens to our elderly populations. People become isolated. There's a natural part of the life course as your friends die from natural causes. There's loss that could happen. But we saw extreme implications for this on those two groups. And I think that also reflects what we think is important at the Center on Policy Initiatives. Sometimes it's not looking at what happens to the average person that helps us tell the best story. It's looking at our most vulnerable people and lifting up structures that support them. All of us who are less vulnerable benefit when we do that. But if we start with the people who are least vulnerable, we might never meet the needs of the most vulnerable.
And brilliantly said. Well, Kelsey, I'm not going to make any assumptions. I would think that I don't think that you're 76 years old, but what I saw earlier today, that might be the case. But I'm thinking that you might be a little younger than me. I'm just guessing. So
yes, a little bit.
Okay. So the peer, you have a peer group, and I know you have a position. You're doing amazing, important work. But what do your peers think about this whole thing? Are you hearing that they don't find it to be as important, or what are they saying?
So many peers of mine are definitely kind of in the same group. We understand like everything that's happening right now. We are taking the necessary precautions. A lot have been in agreement with everything that you both have said, Dr. Green and Dr. Hood. There is not going to be any time that was going to be before COVID. We understand that. And so a lot of us have taken necessary precautions. I have definitely done so on my part with having young kids at home who aren't vaccinated, who definitely need the extra protection. So we are fully masked all the time, and we have limited our visits with our friends and our family members who are also maybe vulnerable. And so it goes the same with all my other peers. They are on the same page regarding that, because we see it as this time will pass. We understand that. But we need to be able to get through it together. And by doing so, we need to make sure that we're taking the necessary precautions, and doing our part. So that's kind of what most of the people that I have spoken with that are kind of my peers are kind of feelings on the current situations.
Your peers sound like some of them are raising young families. They're getting, they maybe have started their career, and they're trying to adjust. And so Dr. Green, you are you work for a place that has policy in its name, the Center for Policy Initiatives, right? So this seems to be a great opportunity to push these policies that maybe you guys always wanted to push, create new ones that better support workers. I mean, what's on the horizon when it comes to policy that we might be interested in? And then
Yes.
Dr. Hood, I'd love to hear what you have to say about any policies that are coming up too.
Yes, I mean, I think some of the policies that we're most clear about are things like expansion of access to sick leave as being a critical thing that many people will have learned is more and more important. The average Californian, we're lucky compared to a lot of places. Most people here are eligible for at least 3 days of sick leave a year, and some is 5 in the city of San Diego, for example. But you can see that just this pandemic indicates that that's certainly not enough availability of sick leave for folks in order to be able to adapt to this disorder or this disease or any other. So sick leave policy is a big part of what we're looking at. I think part of what we're also looking at is the importance of expanding access to organizing in the workplace. So many folks feel that sense of isolation and they want to be part of a community in their workplace where they have a voice, where they're able to help collectively identify what are the needs of the workplace. So there'll be work there. And then I think we've always thought about it as not that worker justice is broader than just what happens in the workplace, although that is a critical component, but it also is all of those structures that help support people in their working lives. And we've seen those so there's a lot of work around developing community schools, really focusing in on the idea that schools are a central part of the community. They serve many needs, as we've seen during this crisis, and there's a need for families to have more of a voice in that space. The other thing I think is we've recognized the importance. Our policy work, I've already said about the Center on Policy Issues, we're not just a think tank. Because when people say a think tank, I think of a set of folks who go in a room somewhere, they think up ideas, whether those resonate with people out in the world or not, doesn't really matter.
Usually
We're
how it
very
happens.
brilliant.
Yeah.
Right. We really are always engaged in the communication with our community in
Yeah, I
partnership.
know you are.
What matters to folks. And I think one of the things that we've heard is that people want to have more voice. We need to help organize people to have voice in these spaces. Across all the things, I think when Kelsey was speaking, what stuck out to me is her family and her peers, they've made adaptations to this, but they haven't necessarily been out in the streets telling everybody, this is how we're dealing with this. And we can often confuse in our world the loud voices that we hear in the media with the position of the vast majority of people. I think every time Dr. Hood says something like that statistic about how many people actually have gotten vaccinated, that seems surprising because we see so much resistance to vaccine, for example. So I think the other thing we're really focused on as a policy organization is making sure that people have data and facts that help inform their decisions, whether they're everyday San Diegans, elected officials, because if you don't have that kind of data, those kinds of facts, we can't develop good policy together as communities because our basis of making decisions is incorrect. If you're running around thinking that most people don't agree with vaccines and don't believe in it, you'll spend a bunch of time trying to tell them that they need to get vaccinated when in fact we have a large population of people like, I'm vaccinated. What else can we do? How else can we support families? What else can we do together to stay safe? So we recognize that that's also an important part. How do we create more ways, policies that raise up voice for people, allow them to participate in public discussions that are not just controversial ones, but the everyday decisions that help shape how we live and how we work.
Yeah, Dr. Hood, in regards to policy that focuses on maybe healthcare or mental health, what are you hearing or seeing out there, or what do you think needs to be done?
Well, first of all, during COVID, they actually mandated employees to give sick leave specifically for COVID. I think it was 2 weeks. Um, However, the beginning of this year, that went away.
Hmm.
I do understand there was some consideration in Sacramento where they're going to extend it retrospectively going back. However, somebody on this, Dr. Akilah Weber, who's assembly person, has just been made chair of a new uh, 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 assembly committee on uh, social determinants of health. She's asked me to serve as an advisor, and the issues that Dr. Green is bringing up fall into that category. I may make a suggestion that maybe a future topic is having her and other members that can take some of the things she's talking about and put them into policy. But
Yes,
one of the things is having that sick leave extended, I think, indefinitely, because I agree, the sick leave, I have for years worked for myself. A couple of years ago, transitioned my practice into San Ysidro Health Center. I'm very happy with that, but now I am an employee and I got certain amount of sick leave, certain amount of vacation leave, and I can tell you for um, uh, prior to kind of getting into the corporate world, I just took the sick leave and whatever I needed off. So
yeah,
I do think I'm very happy to see that the employees are becoming employed. The employee is becoming empowered. They now seem to have more power, but I don't know how long that's going to last. So I agree with Dr. Green. Some policies need to be put in
that's why
place
I
to
say
enhance that.
that's why I say the iron is, you need to strike while the iron is hot
Yeah.
and mold it, because you're right. There's always a retraction in these situations, but I think employees have, hopefully, I'm hoping that they have some leverage here. Kelsey, is there any recommendations or ideas in regards to employers that might be listening? Just so you know, we're showing this over on Facebook and also over Zoom. Most of our viewers are on Facebook, and they'll watch this over and over again in different times of the day. But I mean, any recommendations to employers that might be watching this on how they should create their own internal policy, or that might be attractive to employees?
Yes. So in regards to what, Dr. Green and Dr. Hood said about the sick leave, that's actually really important to these individuals too, because it plays a lot into not just if they get sick with COVID, but like people that they're taking care of, young children or the elderly that they have under their care. And so being able to kind of retro pay them on those sick days that they took out from the beginning of the year as well, and having it continue though, I think would be really stick out to these people, because it will show them that not only do their potential employers care and they take their well-being into consideration, but also, those that they care for. So I really would want for employers to really just kind of listen to what the needs are. I'm sure they're getting a lot of feedback, and policies like this would really help for them to keep their current individuals happy. And the happier the candidates employees are, the better they're also going to be successful for you guys as well in the long term too.
It allows them to be more competitive if they come up with, if they're
Mm-hmm.
very clear about what potential candidates might want, right? I mean,
Yes.
are they asking? I mean, you are, as you said early on, that they're asking these types of questions about their potential employers. They're asking what types of benefits and how they're responding to COVID. So, pretty interesting.
Yeah. So definitely wanting to stay competitive, because if the current client is not doing something that may be their competitor is doing something different, it's to really understand that market so that they can, continue to grow their organization.
Especially for working families like yours, right?
Exactly.
Um, well, listen, we're going to wrap this up. I'm not sure if there's anything else that you all want to add to the conversation. It's been a really great conversation. I couldn't think of a better, panel for this. I mean, all three of you were amazing, and I appreciate everything that you've done. Any other comments at all that you all want to share before we go on and continue to fight for our people?
Now, my only comment, Tony, is keep up the good work. I think this type of dialogue needs to take place. And I want to thank Kelsey and Dr. Green. And Dr. Green has left me with a lot of food for thought. I need to think more carefully about how I frame. We need to get back because I totally agree. It needs to be done with caution, especially in the underserved populations who are still suffering the most from this pandemic.
Thank you, Dr. Hood. But with that, listen, we appreciate you all. And I hope to have all three of you back at some point in time. You know, we do this just about every month. And, you know, this is a very important part of what we do. So, and you all are a very important part of it. So thank you so much for being a part of it. Just so you all know, we have partners that we engage with on this issue and other issues. Youth Will, Logan Heights Community Development Corporation, the San Diego Foundation, the Jacobs Center for Neighborhood Innovation, and BayPAC. Those are some of our partners. Some of our upcoming programs, as you all know, I told you before, we do training. I think we're probably one of the best nonprofit trainers in the business. Our organization has packed them in for the last 5 or 6 years in regards to this type of training. This next one is going to be on social media content and workflow. I get the best trainers that I can find in this city, and they provide just really high level training and at no cost. We fundraise to make sure that we can get that. Our next Rise Now will be Wednesday, March 16th between 12 and 1 p.m. And, you know, before you all go, there's a poll question that is out there that I think I saw on the screen. And basically just asking you how you would rate this virtual event. Excellent, good, fair, poor, and how likely would you recommend the event to a friend or a colleague? So if you can, please do that for us. It helps us to explain to others why they should support what we do. So thank you. And with that, you all have a wonderful afternoon. Please be safe, get vaccinated, listen to Dr. Hood, and, you know, just make sure that you all go home and hug your family or whoever that's next to you. God bless you. Thank you.
Thank you.